Hello, my name is Regis Paulinelli. I'm a mastologist, breast surgeon in Brazil. I work in a large cancer hospital here, where I'm in charge of breast reconstruction. I'm the current president of the Department of Oncoplastic Surgery of the Brazilian Society of Mastology. I'd like to thank Dr. Andriy Zigulin for the opportunity to be here with you in Ukraine. I will talk in the next 10 minutes about training in oncoplastic surgery, and I will bring to you a little what's done in the world, especially in Brazil. I think it can be a model of training and serve as inspiration for many of you. There is an increasing interest in oncoplastic surgery around the world. We published some years ago the number of publications about it by year and by countries, and we can see the increasing number of publications. The term oncoplasty was coined by Dr. Werner Aldrich in Germany in the 80s to refer to a combination of breast conservation and techniques of plastic surgery for partial breast reconstruction. Some people nowadays call every kind of reconstruction as oncoplastic surgery, but I prefer to stick to the original meaning. So when I say oncoplastic surgery, I'm talking about mammoplasties and local regional flaps. When I say breast reconstruction, I'll talk about expander, implants, myocutaneous flaps, or microsurgery. I first learned partial and whole breast reconstruction in Brazil during residency with a plastic surgeon trained with Dr. Hartranft in the United States. Then I went to Italy and Germany to learn from some of the pioneers in these techniques, Dr. Werner Aldrich, Dr. Jean-Yves Petit, and Dr. Mario Richins, originally developing these techniques in France, and then invited to work in the European Institute of Oncology in Italy. There are many ways of learning oncoplastic surgery and breast reconstruction. Junior surgeons can learn it during specialization and fellowships. Senior surgeons can learn it during hands-on courses, virtual courses, videos available on internet, books, and congresses. You must be more familiar with the British way of training in oncoplastic surgery. When I was in England in 2002 at the Guy's Hospital, there wasn't yet this kind of training in oncoplastic surgery, but nowadays it's common. Many breast surgeons apply for an extra year of training in oncoplastic surgery. You can be a breast surgeon or plastic surgeon to apply. Breast surgeons usually aren't trained in myocutaneous flaps and microsurgery there. Here in Brazil, it is an independent specialty. After gynecology or general surgery, you can enter the residency in mastology for 2 years, in which you can learn the regular oncologic breast surgery, but also dedicate yourself to breast imaging, chemotherapy, aesthetic and reconstructive surgery. Mastologists in Brazil learn all these abilities from the beginning and during all the specialization. Of course, there are different opportunities and personal preferences, and some mastologists dedicate themselves more to a specific field than another. Creating mastology as an independent specialty was very important to the development of breast surgery in Brazil. Nobody can say or impose what mastologists are trained to perform, except from the Brazilian Society of Mastology. It's a huge advantage and freedom to those interested in learning. There are plastic surgeons and surgical oncologists in Brazil also trained in breast reconstruction, but they are proportionally fewer. Most plastic surgeons in Brazil are more interested in aesthetic surgery for economical reasons. Many didn't have had the opportunity to be trained in breast reconstruction. I think this must be true in many countries. Some years ago, we asked to the residents finishing the 2 years of mastology from all over Brazil who was in charge of breast reconstruction in their breast units. And you can see that there are different realities here. In the university hospital where I worked, both plastic surgeons and mastologists are trained in all kinds of breast reconstruction, and according to availability, the patients are operated by one team or the other. It is the most common reality in Brazilian breast units. This way we can benefit a larger number of patients, and everyone in our breast unit that wants or need any kind of reconstruction has the opportunity to have it. In most residencies in mastology, our residents are fully trained in breast reconstruction during the whole residency. For those mastologists that haven't had the opportunity to be well trained or who feel the need of more training, there are many hospitals, including ours, that offer an extra year dedicated to oncoplastic surgery and breast reconstruction. There are also fellowships available in breast imaging and chemotherapy according to each one's interest. Especially for senior mastologists or for plastic surgeons interested in breast reconstruction, we organize a virtual hands-on courses on oncoplastic surgery and breast reconstruction in Brazil with simultaneous translation in Portuguese, English, and Spanish with attendees from many countries. Recently, Dr. Andrei Zigulin also participated as a debater, commentator of surgeries in our course. There are 12 places face-to-face, hands-on, and 25 places online. In our course, we perform together around 100 live reconstructive procedures in 11 months in 3 simultaneous operating rooms, 2 days a month. There is participation of great names of oncoplastic surgery around the world as surgeons or debaters. It is really possible to learn from the basics to the more advanced techniques. It is directed to breast surgeons, plastic surgeons, and surgical oncologists. I would like to invite you to get to know about it in our website, oncoplasticsurgerycourse.com. Over 500 breast surgeons attended or are attending to this kind of hands-on course in my hospital or in some other breast units in Brazil. We are around 2,500 mastologists in Brazil. Around 500 mastologists, 25% of them already have attended to this kind of course. We have published some years ago the results of the learning process with this kind of course, and our attendees really learned it. We discussed their cases during the course, and many of them send some pictures or ask our opinion in some cases, and almost every surgeon was able to learn properly and is doing an excellent work in their cities or countries. And interestingly, virtual attendees had the same level of learning because it was possible to see everything in detail using the cameras. All procedures, classes, and discussions are recorded to be seen again and again if needed, so there isn't any problem with time zone because you can see it again if it's too late in the night or too early depending on the country. We asked the attendees for what they used to do before the course and what they are doing now after the course, and most attendees are performing all kinds of breast reconstruction, including myocutaneous flaps and more complex surgery. There was no statistical difference between the two groups, face-to-face and online attendees. We organize also face-to-face cadaver labs. Some courses operating on live pigs in Brazil also. After the pandemic, it was economically inviable to do the cadaver labs here in Brazil because there was a devaluation of our currency, and fresh frozen cadavers come from the United States in dollars, and it was very expensive. Now we are organizing a cadaver lab and wine experience at the Nicholson Center in Orlando. The next one will be in November, the 3rd and 4th of 2024. It was much easier and less expensive than organizing it in Brazil. Now it's again available for colleagues around the world. It's still possible to subscribe. There is in Brazil also a course using master trainers. There is a kind of dummy or a special foam which has a consistency similar to the breast, which is with all the anatomical planes, which also allows the realization of some techniques of oncoplastic surgery and breast reconstruction. And when I began my training in breast reconstruction, very few surgeons were interested or had proper training in oncoplastic surgery. In my city only there was a university hospital with one plastic surgeon that performed this kind of surgery once a week, and who I was initially trained. In the cancer hospital, when I began to work there, there was a plastic surgeon that performed around 5 breast reconstruction in 1 year. Now we have doubled the capacity of breast reconstruction in the university hospital, and we perform hundreds of breast reconstruction every year in the cancer hospital. In all other breast units in my city, there are former residents or former attendees from our course performing breast reconstruction. I'm very happy that we totally changed the reality of access of breast reconstruction in our city. Now almost every woman in need or wishing a reconstruction can have it. There are some congresses in Brazil that we are part of the organization, and I'd like to highlight for those interested in reconstruction some opportunities. The Brazilian Journey of Oncoplastic in June, that is face-to-face in São Paulo, and it's totally dedicated to breast reconstruction, and the Brazilian Breast Cancer Symposium, that is hybrid. It's more dedicated to breast cancer research in general, but it has a large section dedicated to oncoplastic surgery. There is simultaneous translation in English, and there are attendees from many countries. And you can find hundreds of educational videos and some classes on my personal website, oncoplastic.com. I created the website at the beginning of the pandemic to help colleagues and alumni interested in oncoplasty. Currently, thousands of surgeons from all over the world are using the website. I'm very happy to be able to contribute in some way to many people. Thank you very much again to my friend Andrew Zigulin and all the colleagues from Ukraine for the opportunity to be here with you. I join my prayers to yours, hoping that the war is over very soon and everything returns to normality again.